Thank you, everybody, for joining today. I see already in the chat we've got people from all over the country and even internationally, which is great. So I hope this will be a informative talk for you, and you'll take something home from it that you can use for your birds. The topic of hormones in birds is a really common one. I hear almost every day in my exam rooms about hormonal birds or problems with egg laying or other reproductive problems. And so it is a very important topic to know about and to know what causes the hormones to ramp up and things that we can do to try to control those hormones so that we avoid problems with our birds. Let's see if I can get this thing moving. There we go. So why do we care about this particular problem? You know, hormones are natural for birds. Why don't we just let their hormones do what they're going to do? Well, the hormones are natural, and in the wild, they do definitely serve a function. But if they get out of control in our homes, they can cause a number of problems. In the females, we can see egg binding, where they're not able to lay the egg. We can see what's called yolk stroke, where they actually have brain injury from their blood being too thick as it's preparing to put nutrients into the egg. We can have problems where the egg is misovulated and they get inflammation and infection in their body cavity. They can prolapse from straining, where internal organs become externalized because of the straining. In the males, we can see lots of behavioral issues, aggression. A lot of times we'll see either feather picking or self-mutilation in the males as well. And so it just makes it a lot more complicated to deal with these guys in our homes. And so the best scenario is to try to keep the hormones from ramping up, because there's no real purpose for them. We don't want our birds to reproduce in our homes. And so, you know, we try to make their lives as good as we can without that one aspect of what they have in the wild. So today, what we want to talk about are, first of all, what are the signs of hormonal behavior? Because I hear all the time in talking with clients that my bird is hormonal, or when my bird acts hormonal, you know, I do this or whatever. And so they use hormonal behavior or hormones as a label to describe things. But everyone's definition is different. So we're going to talk about what things are attributed to hormones and what other things may not be attributed to hormones. We talk about things that will ramp up the hormones and cause them to become higher levels in the body, egg production in the females, enlargement of the testes in the males, that kind of thing. We'll briefly touch on testing, things that we can test for to see if the birds are hormonal. But really, honestly, there's very little that can be done with that. And then a lot of the talk is going to be about how we deal with this hormonal behavior, how we can change the bird's behavior, our own behavior, modify the environment, modify their diet, and if we need to, intervene medically to try to control these hormones. So that'll be the majority of the discussion today. So what does hormonal behavior look like? I went to trusty Google and I put in hormonal behavior in parrots and then looked at images. And these are some of the images that I came up with in my internet search. So shredding, this is definitely something that can be associated with hormones, but this is a goffin cockatoo, and goffin cockatoos love to shred things, as most parrots do. So is it a hormonal behavior or is it not? It could just be an everyday behavior. But this is something that came up on Google. Aggression is something that definitely a lot of people associate with hormones, and we'll talk about that more as well later. Nesting, shredding up paper in a cavity, making a nest, definitely hormonal behavior. But this also showed up on Google, feather picking or feather destructive behavior. And as most of you know, there are dozens and dozens, if not hundreds, of reasons for birds to start damaging their feathers. Hormones certainly are one of them, but there are many, many other causes of feather picking. And these two images that were up that came up on my internet search, I don't know that I necessarily see this pattern of feather picking or feather destructive behavior with hormones. And we'll talk about the specific patterns that I have seen later on. Is this hormonal behavior, or is this just like conures being conures? But this is something that came up on the internet search too. This obviously is a mating behavior in a bird, so definitely we can call that hormonal behavior. And then obviously the ultimate thing with the females is the egg laying, and that tells us for sure that she is hormonal. So those are kind of some things that came up with the internet search. Interestingly enough, there were also a number of images that came up talking about how to deal with hormones in parrots. And I'm going to give these people the benefit of the doubt, saying that their cover picture was not what was in their verbiage when you go to their website and look at it. But the cover pictures definitely are showing things that you should not do if your bird is hormonal, or maybe even contributing to your bird being hormonal. So here's the first one. What a hormonal bird looks like. First of all, this looks to me like a baby macaw, which would not be hormonal. But just the whole snuggling with the bird and pressing up against its back and whatnot can be a trigger for hormones. So this is something that you definitely do not want to do if you have a hormonal bird. Like I said, hopefully they will elaborate on that in their website. Here's another one, hormonal behaviors and how to calm them. So this woman has this caïque on her shoulder, and she has that long, beautiful hair, and it's a great place for the bird to want to nest in. And you can see he's just like all like excited. He's just all fluffed up and with his head turned and whatnot. And so this is not a place that you want to encourage a hormonal bird to be, because that just exacerbates the problem. For those of you that have cockatoos, and particularly male cockatoos, and that are hormonal, this is the one place that you absolutely positively do not want to put a hormonal male cockatoo near your face, because that's an extremely dangerous situation. But again, this came up on the internet search. This also came up on the internet search, and it was so disgusting, I just had to put it in here. Obviously, we discourage, for multiple reasons, people feeding their birds from their mouths. But in relation to hormones, the one mate will feed the other mate regurgitated food, which is warm and wet. And so this actually simulates mates feeding one another, and certainly is a catalyst for hormones. So again, for multiple reasons, but in particular regard to this talk, you definitely don't want to do this with a hormonal bird. So what is hormonal behavior? Like I said earlier, a lot of people like to label birds as being hormonal, and the behaviorists hate that. And so they say, don't use labels. Tell me what you see. What is the behavior that you were looking at? And so what hormonal behaviors are instinctual. Remember, our parrots are very closely related to those in the wild, with a few generations away from their wild counterparts. And so a lot of the behaviors that they have are hardwired in there, including their reproductive behaviors. So they're instinctual behaviors, and they cause an increase in sex hormones and allow the birds in the wild to be able to reproduce and successfully raise their babies. Now, some of these behaviors by themselves can cause the hormones to increase. So, for example, nest building can be a catalyst for hormones, building up the hormones. Courtship displays is another thing that can ramp up the hormones. You can have a effect on the hormones just from the behaviors themselves. And then the important thing that we'll talk about a lot in the next few minutes is that a lot of these behaviors are normal day-to-day behaviors with birds and aren't necessarily associated with hormones. They can be associated with hormones, but they also can be just a normal day-to-day behavior for a bird. So it's important to know which are a normal activity for the bird and when the bird's starting to act hormonal. So normally we look for combinations of behaviors to tell us when the birds are acting more hormonal. Briefly, to go over reproduction in the wild parrots, because again, our parrots basically are wild parrots. And before I start this, I just want to say that for your species of birds, you should try to learn the specifics for your particular kind of bird that you have, because every bird is a little bit differently. Their breeding seasons are different, their nest selection may be different, that kind of thing. And so you want to get to know what's normal for your bird. You can do that by going on eco tours or something like that, or watching your birds in the wild, seeing the birds in the wild. A resource that I always recommend is Rosemary Lowe's book called Understanding Parrots, Cues from Nature. And she has spent years and years observing parrots. And this book goes into great detail about behaviors in birds, not only hormonal behaviors, but all kinds of behaviors in birds, and separating them into different species as well. So it's a really great resource to have. Again, it's Understanding Parrots, Cues from Nature by Rosemary Lowe. And so that may give you some information about your particular bird. But in the wild, we have these birds that reproduce in certain seasons for most of our parrots. There's a particular time of year that they will reproduce. And it's the time, it depends on the rain, the amount of rain, it depends on the amount of food available, the availability of nest sites, that kind of thing. But they're usually, except for like the collectus parrots, there tends to be a fairly short season for the breeding season in some of these parrots. So that you have the season, and then they have to select a mate. So they have to find someone that they want to reproduce with. And then the courtship begins. So they have the vocalization, you have the displays, you have the male trying to win the attentions of the female. And then once they choose each other, then you have them hanging out together, preening each other, feeding each other, finding an appropriate nest place, excavating that. Usually in parrots, it's a cavity. In something like Quakers, they will build the nest, but they prepare the nest. And then once they prepare the nest, they will normally defend that nest quite aggressively, because especially with the destruction of the rainforest, we're seeing a lot of these nest sites disappearing. And so the parrots have become very protective of their nests that they have. And then once they have prepared the nest, they mate, they lay the eggs, and then raise the babies. So we'll start at the end. We'll start with the egg laying, because that's a true sign of hormonal behavior. If you have a bird that's laying eggs, it definitely is hormonal. But I'm hoping after today's talk that you will recognize the signs of increasing hormones before it gets to this point. Because once the eggs are being produced, that means there's more risk for the female to develop all the problems that I talked about earlier. So we want to catch it well before this point if we can. Masturbation is another thing that we see in relation to hormones. And, sometimes it can be just as simple as modifying the environment. Like, for example, in this case, we have this bird that's masturbating on the handle of his cage. So the simple thing to deter him from doing that is to put the handle so it's flat on top of the cage. Same thing with toys in the cage or perches. You can rearrange things so that makes it more difficult for the bird to mate with his favorite toy or whatever. The females will also masturbate. They often will, especially like cockatiels, they'll lift their tail and they'll back up to something and they'll start panting and whatnot. Some of the cockatoos will, or other species will rub their backs against something and they'll kind of get that glazed look and they'll start panting. And you want to try to avoid these things because that is ramping up the behavior. So like in this case, obviously moving the leg, getting the bird away from the table to keep them from being able to pleasure themselves that way. I hear this a lot with the cockatiel and parakeet owners about how cute it is that the birds are regurgitating to their finger or their toe, or they're mating with their finger or their toe. I don't know. I don't know what it is about these particular species, but for some reason they seem very enamored with people's appendages. So, but it is, I guess it can be cute, but it does cause the hormones to ramp up in these birds. And so it's definitely something that you want to discourage. The nest building and cavity seeking is another thing that typically is just associated with breeding and reproduction. So we do consider that a hormonal behavior. The cavity seeking, like in this case, the people provided a tray for the cockatiel to make her nest in. That's really encouraging hormonal behavior, which is not what we want to do. I suspect that they've had problems with the bird laying eggs in the past and the bottom of the cage or off the perch or something like that, and they want to give it a place where it could safely lay its eggs. But hopefully we can manipulate things so that it doesn't get to the point where the bird wants to lay eggs. But certainly if the bird is seeking out a place like a box, or for some reason I hear drawers all the time. Oh, my bird lays eggs in the drawer, and I never understand that, because how does the bird get into the drawer? But anyway, so if your bird is wanting to go into a drawer, then you definitely want to kind of keep that drawer closed and discourage it. Boxes are great for birds as far as chewing, and you can do foraging with boxes and all kinds of things, and it's great to keep them occupied mentally and physically. But in a hormonal bird, they can actually start using that box as a nest cavity. And so you want to be careful with that. So in those situations, I don't say not to give them boxes, but maybe you can give them boxes that are too small for them to make a cavity in or something like that. So they can still get the pleasure of tearing things up and finding treasures inside, but they can't physically go in there and excavate a nest. Regurgitation and begging for food is something that we associate with breeding, but it also is associated with other things, other diseases and other problems in birds. So if a bird's regurgitating, it doesn't necessarily mean that it's hormonal. Now, a lot of you have probably seen parakeets or cockatiels that regurgitate to themselves in a mirror. That we consider generally a hormonal behavior. And some birds will regurgitate to their owners as well. But there are the things like crop infections, avian ganglioneuritis, intestinal foreign bodies, systemic illness like liver problems, kidney problems, things like that. Systemic infections can cause regurgitation as well. And also, a lot of birds, when they are not feeling well, they will revert back to being babies. And so they'll start begging, just like they did when they were babies. We see that quite frequently in birds that we have hospitalized, or birds that come in that are sick. And so the begging behavior isn't necessarily, a mate wanting to be fed by another mate. It may be that the bird is actually sick. So again, it's one of those things where it could be associated with breeding or it could not. Cloacal or uterine prolapse certainly can be associated with hormones. If the bird is trying to pass an egg and it's maybe overweight, it may be there was a problem with the egg and it got stuck somewhere in the reproductive tract. It could be that the egg is unusually large or something along those lines, and the bird is straining to pass the egg. It could end up prolapsing, where either the cloaca comes outside the body, or even the uterus and the females can come outside the body. But there are other causes of prolapse as well. So inflammation of the cloaca, infection in the cloaca can cause straining and will cause the cloacal prolapse sometimes. They can get little growths or tumors on their cloacal lining, and that can cause irritation, straining, and prolapse as well. Anytime they have chronic diarrhea or chronic constipation and they're pushing a lot to pass their droppings, straining, that can cause it. I mentioned before, obesity is one thing that is a very common cause of prolapse, and so you always have to be careful to try to keep your bird at a good weight to prevent things like that. And then I put the last thing, cockatoos and behavioral prolapses, because a lot of people like to potty train their birds, and a lot of cockatoos, particularly the Indonesian cockatoos, the umbrellas, the goffins, the Moluccans, they often will have kind of like an OCD personality. And so they get in their head that you want them to be potty trained and poop on command and whatnot. And they will just obsess about this, and they'll constantly strain to pass droppings, even though there's nothing really to come out at that point. And so some of these birds end up prolapsing. And it seems to be a big problem in these cockatoos that I talked about. Virtually all of the non-reproductive prolapses that I see are in cockatoos. Aggression is another thing that we often hear associated with hormones, and certainly it can be. Those of us that deal with Amazons know that in the breeding season, the Amazons can become very aggressive and very unpredictable. But it's true across the board that aggression generally increases because they're defending their nest, they're defending their mate, that kind of thing. But again, we all know that aggression can be associated with a lot of other things as well. So just because a bird is aggressive does not mean he's hormonal. Other causes of aggression could be fear, where they're afraid, they can't fly away. And so, their next best defense is to bite. Along those lines, self-protection to keep themselves safe. If they're painful, just like us, if we're painful, we are very irritable and we're more aggressive. Same thing with birds. If they're uncomfortable for some reason, they tend to show more signs of aggression. Some birds are very defensive of their territory. Quakers are notorious for being very defensive of their cage, and that's just a natural thing. Caiques as well can be very territorial, and so we just learn to allow those birds to come out of the cage rather than us going into the cage to get the bird, and that generally will solve the problem. And then there's learned aggression. So, I always tell the story about, I had a client who had a cockatoo that would constantly chase the husband around the house and bite at the husband's feet or ankles. And so I was talking to the wife about when this behavior started, and turns out that it was kind of like an accidental thing. The bird kind of reached out and touched the husband's foot, and the husband reacted, and then the wife started laughing, and the bird was very attached to the wife, and he was like, oh wow, I did something that was really great. And so then that ramped up into going after the husband's leg, which caused the wife to laugh more and more animated response from the husband. And it was like a positive reinforcement situation where the bird actually learned to be aggressive towards the husband because it thought it was being rewarded for it. So there is that kind of aggression as well. Shredding. So this is what we mentioned it briefly earlier, but shredding is a normal everyday behavior for birds. Birds, if you've ever seen birds in the wild, they spend a lot of their time just tearing up things. They'll find this beautiful fruit in the wild and they'll just tear it all to pieces to get to the seed in the middle of it. Or they'll chew up leaves, they'll chew up sticks, grass, things like that. And it's just a normal behavior for them. Yes, it can be associated with hormones. So it is part of nest building for a lot of our parrot species. And so it can be associated with hormones. But does every bird who shred something, is every one of those birds hormonal? No, absolutely not. Should we not provide shredding material for birds because it can be a sign of can trigger hormones? No, it's a normal thing. But in a hormonal bird, we try to rethink these things and modify it. So in a bird that's acting hormonal and we see other signs of hormones, then we may want to limit their access to shredding material during that time. Other signs that could be associated with hormonal behavior are increased appetite. Remember, the females have to put all their nutrients for the chick into the egg before it's laid. And so they generally start consuming more before they will lay their eggs, and they a lot of times will increase their calcium consumption as well. But there are lots of other causes of increased appetite. A lot of diseases can cause them to have an increased appetite. Malnutrition can cause them to try to consume more foods to get the nutrients that they're lacking. And same thing with the minerals. If they're lacking in minerals, they may start trying to consume more minerals. A bird that's not getting adequate UV light and therefore it's not having adequate calcium absorption may just start chewing on a cuttle bone or a mineral block trying to get that calcium because it doesn't have the UV light to help with the calcium absorption. Increased vocalization is another thing that we associate with hormones, but there's many, many reasons for increased vocalization, including learned behaviors like we talked about with the aggression. They learn that if they vocalize, they'll get a response from their flock mates or their owners. And so they'll keep doing it. But it is something that can be associated with hormones. And then feather destructive behavior, as we talked about earlier, can be associated with hormones in some birds, but there's many other causes of feather destructive behavior. That's a whole, not even a whole hour, that's like a whole seminar, several day seminar on all the causes of feather destructive behavior. But in association with hormones, the patterns that we typically will see are in the females. They often will pluck on their chest to make what we call a brood patch, and that allows their skin to come in contact with the eggs to allow for increased incubation success with the eggs. It doesn't happen with all the females, but some females will do this. In the males, sometimes I will see when they're chronically reproductively active, they will start picking at their backs. So either like between their shoulder blades or a little bit farther down their back. And I don't know if that's a pain or discomfort thing because the testicles are sitting right there and they may be enlarged and pushing on something. I don't know what it is, but I see that pattern. And particularly in cockatiels, I see it, lovebirds as well. And when we kind of manipulate everything and suppress the hormones, a lot of times that will go away. So those are the two main patterns, I'd say, that I see with feather picking or feather destructive behavior in the parrots. Now, some birds are, if they're chronically reproductively active, will get very frustrated and just start shredding some of their feathers. So there is that as well. But I would say that's rare. That normally there's something else that's contributing to those birds that just randomly start shredding their feathers. All right, so let's talk about some of the things that will ramp up the hormones. Changes in daylight hours. As I mentioned earlier, the parrots have their seasonality to their breeding. And when the daylight hours approach what would be normal for their breeding time, then the hormones start circulating more. Abundance of food. They want to make sure that they have, if they're going to raise chicks, that they have the food available and the resources available to successfully rear them. And so they're not going to raise birds in a drought, for example, when the food's not available, or in the season, like in the places where you have colder weather, where it's not the growing season. They're not going to generally breed in those situations because it doesn't lead to a lot of success raising those babies. They have to have a suitable nest site, and once they get that nest site and start excavating it, that will cause an increase in the hormones, and as well as the nest building materials. And of course, a mate. If you have a mate around, then obviously your hormones go up. We all know that, right? Unless they've been around for a long time, and then the hormones go way down. I'm just kidding. But so all these things can cause an increase in the hormones circulating in the blood. And these are things that we can modify, or at least keep in mind when we're trying to address a hormonal bird. Like, how can we change these things or tweak these things a little bit to maybe suppress the hormones rather than ramp them up? As far as testing, like I said earlier, there's not much that we can do in the way of testing. In the females and their normal blood work profiles, we will see some changes in reproductively active females. So for example, the protein level, the albumin level in the blood will go way up. The calcium level will go way up. Phosphorus will go way up. Cholesterol will go up. So all these things are very common in reproductive birds. Radiographs, so we can take x-rays. The top one that you see there, right here, you can see the outline of the egg, and that's obvious that the female is reproductively active. But in the bottom one, there's no egg present here, but what we see in this bird is she's got kind of a brightening of the long bones. You can see compared to the other. See how much brighter these are than here. And that's when they start to mobilize calcium to put in the egg. We see this change in their long bones. And so that could be a way, before the eggs are being produced, that we can see that this female is reproductively active. We can do hormone testing, or let's say hormone testing is available in a research setting for birds. It's not available like for the average clinical bird. So it's not something that we routinely do in birds at all. And I put up there crop swab because a crop swab can help us distinguish regurgitation as either from hormones or whether it's from something like a crop infection. All right, so here's the important part of the talk. We know like what can ramp the hormones up. We know what these behaviors may look like, but what can we do about it? How can we change things in our households so that our birds aren't hormonal all the time? And that involves several different aspects. First, we want to change behaviors. So we want to change the birds' behaviors. And then we also want to change our behaviors so that we're not inadvertently causing these hormones to increase in their blood. There are things that we can change in their environment that can suppress the hormones. There are changes in their diet that we can make that will also suppress the hormones. And if we need to, we can medically intervene with hormone therapy and try to get these hormones to come down. But honestly, in most cases, just doing a good job with the first 3 bullets here are all that's needed. If we do a good job with those first 3 things, then we often don't have to do any medical intervention. So let's start with modifying the bird's behavior. So they're acting hormonal. We've determined that their hormones seem to be ramping up. What can we do? Well, we want to provide them activities that will keep them busy. Foraging, make them work for their food, keep them busy. Don't just put a food in the bowl, make them use their daytime hours, trying to get food, tearing up things. Give them new toys, something to show an interest in. Teach them tricks, like this bird here, putting the rings on a stick. That's a great mental activity for them as well as a physical activity, and it keeps them distracted from their hormones. Exercising them, so either flying them, even running across the room, teaching them to fetch something and bring it back, that kind of thing, all can be alternative behaviors to hormonal behaviors. And then obviously, if they are regurgitating or masturbating, you want to redirect them from that, give them alternate activities to take their mind away from those things. Modifying our behavior. So most people have heard over and over again, don't pet your bird below the neck. Anything below the neck is reserved for a mate. And so for those that stroke their bird under their wings, down their back, anything like that, especially in a hormonal bird, you do not want to do that because that's going to stimulate them more. As we mentioned earlier, you don't want to feed anything from your mouth because that's definitely a breeding behavior. Don't allow the birds on your shoulder, in your hair, or for some reason with the conures, we see this a lot down the shirt. The conures like to be there and the owners like for the conures to be there, but it is definitely cavity seeking, hormonal, can ramp up the hormones and whatnot. So in a hormonal bird, you definitely don't want them to do that. In the shoulders, the hair, we talked about that before. It's a great simulation for a nest being up there. So discourage that as well. And then you don't want to reinforce any undesirable behaviors. So for example, the birds that are regurgitating or masturbating on the owner's hand or on their foot, or something like that, you don't want to reinforce those or encourage those behaviors. Modifying the environment. So if they have access to nest sites and they're acting hormonal, then you want to remove those nest sites. So that could be happy huts, it could be drawers, it could be, for some reason, under the furniture seems to be a big one. You know, there's I don't know what it is, a tendency for some birds to want to be under furniture in order to reproduce. We had a client whose bird was constantly going under the couch, and they thought it was just kind of sleeping under there, whatnot. And then one day they moved the couch and there was like a dozen eggs under there. And so you definitely want to try to discourage that, block off access to being under the couch. If they like to go under the paper, then you may need to change the substrate that you use at the bottom of the cage, or put a grate so that they can't get under the paper. And then boxes, we talked about earlier, you don't want them to construe a box as a nest. As far as the happy huts go, certain species, like some of the conure species, like to sleep in cavities. Again, knowing your bird, knowing your species of your bird will often help to know whether this is applicable to you or not. But so in those birds, it's fine for them to have happy huts, and even for other species of birds, if they're not acting hormonal, I don't have a problem with happy huts. It's just when the birds when their hormones start ramping up, you don't want them to have access to any kind of what they can construe as a nest. Other ways you can modify the environment are to change the cage around. So put new toys in there, move the perches, move the toys around, move the cage to a new location. Again, we talked about earlier, if they're masturbating on something, then you remove those or put them in a position where they're not able to do that anymore, and then remove the nesting materials. Remember, these birds like stability and good environmental benefits, for example, food or nesting materials or whatnot, is going to make them want to reproduce. So if suddenly their environment is all changed around, if the cage is in a new room, if the cage itself doesn't look the same, if things are different, there's something new in there, that may shake them up just enough to say, okay, this may not be a good time to want to breed. We want to check this out and see if this is going to be a safe place to raise our babies. So, those kind of things seem kind of negligible, but they can make a big difference. Other things you can do are modify the daylight hours. So for the subtropical birds, we try to get them to have 10, ideally, maybe 12 hours of light per day. And then the rest of the time, cover up the cage, cover up the birds so that they're not getting any light. And that can fool their body into thinking it's not a good time to reproduce. If you have a bird that is right at the equator, comes from right at the equator, the manipulation of the light is not necessarily as effective because they're used to about 12 hours of light a day. And then providing a safe outdoor space where they can get UV light and can also help to control the hormones in a couple of different ways. One is it will stimulate the pineal gland and kind of keep them more mentally engaged and not necessarily thinking about breeding, but also, again, it's a change in environment, like putting them outside during the day and then bringing them inside at night. It may be enough of a change for them where they become less comfortable trying to breed. We can also modify their diet in order to try to suppress the hormones. Remember, they have to put all the nutrients for the chick into the egg. And so if we make the food less abundant or less rich, then they may not think it's a good time for them to be breeding. So one thing you can do is decrease the fats in the diet. There's a lot of fat that goes into the egg. And so by decreasing the fat, that may suppress some of the hormones. Decreasing the calories in general to make them think that it's a kind of a more of a lean time of year, a lean season, rather than a abundant season for them to reproduce. That may make them less hormonal. And a lot of people they don't like their bird to go hungry. And so they like the bird to have something in the cage all the time to eat. And even in non-hormonal birds, I don't think that's necessarily a good thing. I think it's beneficial for birds to have a period where they don't have access to food. But it's particularly in breeding birds or hormonal birds, if they have access to food all the time, that's like a great buffet. They know they have a great source of food for their babies, and so they're going to want to reproduce. But if the food isn't there all the time, then their body will be thinking, well, maybe this is not quite right. So it's another way that we can kind of control their environment to discourage them from breeding. Modifying certain ingredients of their diet or foods in their diet can also help suppress the hormones. So some foods are naturally high in phytoestrogens, which are kind of plant-derived estrogens, and act very similar to the estrogens in females. And so things like soy, flax are very high in phytoestrogens. And then all the other things that you see on the list can have higher levels of phytoestrogens as well. And so in a bird that's acting hormonal, maybe restricting access to these foods will help suppress the hormones a little bit as well. So again, I'm not saying don't feed these foods. These are, a lot of these foods we recommend. They're very healthy, very good nutritionally for the birds. So I'm not saying do not feed these foods to any birds. What I'm saying is in a hormonal bird, these are foods that if you try to limit those hopefully will help suppress the estrogen levels in the females. Medically intervening. So there are some drugs that we can use to try to suppress the hormones, and we'll go over those in a minute. There are some times that we have to medically intervene to either help a bird that's having problems or to try to prevent problems. So sometimes when the egg is not able to be passed and the birds are egg bound, we have to remove that egg, whether it be some, a lot of times we can just what we call implode the egg, where we put a needle into the egg, we aspirate the contents out of the egg and collapse it, and then remove the shell. If the egg is adhered to the uterine lining, or if there's multiple eggs that are coming one behind the other and are stuck, sometimes we have to go in there surgically and remove those eggs. Obviously, if we kind of practice the things that we talked about earlier in the talk, we won't get to that point and have to deal with that. But it is something that we do deal with on a fairly regular basis. And so, it's something that is hopefully avoidable, but it's and especially like in cockatiels and lovebirds, this is a very common thing. Prolapse repair is another potential sequela to egg laying, and sometimes we do have to go in and put those pieces back where they belong and suture them in. And then spaying and neutering we'll talk about a little bit later, but that's not a routine thing that we do in birds, and we'll go over that. The key is that we want to try to avoid having to deal with surgery in the birds and trying to get at things before we get to this point. So here's a diagram of the sex hormones in this. Unfortunately, this diagram, the only one I could find was in a male, but they're exactly the same in a female. Just the target sex organ is different and the hormones produced are different. I'll go over that when we get down to it. But it starts up in the brain, and the hypothalamus in the brain produces an hormone called gonadotropin releasing hormone. And that stimulates the pituitary gland to produce two different hormones, follicle stimulating hormone and luteinizing hormone. So in the males, as you can see in this picture, the follicle stimulating hormone causes the male to produce sperm, and the luteinizing hormone causes the male to produce testosterone. In the female, the luteinizing hormone causes estrogen to be produced, and the follicle stimulating hormone produces the follicle of the egg. Both the estrogen and the testosterone have what we call a negative feedback loop. So when those levels go up, they come back and they affect both the hypothalamus and the pituitary gland, causing a decrease in the production of these hormones. So the more testosterone and estrogen that builds up, the more there's negative feedback here. And that we use to our advantage when we're intervening medically to try to control these hormones. Some people are familiar with HCG, or human chorionic gonadotropin, and that's something that used to be used for trying to control the hormones in birds. And the problem with that is, well, two problems. One is it intervenes down here at the level of the right at the sex organ, the hormones that affect the sex organ. And we saw problems with resistance over time. And because it's coming at this loop, it doesn't affect the negative feedback as much. And so as time has gone on, we have started to use drugs that come up and act in this area in the brain, and we seem to have better luck with that. And the most common one that's used is leuprolide acetate, or Lupron. This is more commonly known, and that works up at the level of the hypothalamus and suppresses the gonadotropin releasing hormone. So it decreases that, which then in turn decreases the follicle stimulating hormone, the luteinizing hormone. And the way it does that is it actually causes an initial up ramping of these things, which is kind of counterintuitive. So it will stimulate this, the hypothalamus, which stimulates the pituitary gland, which stimulates the sex organ to produce more sex hormone. And you get this initial surge of sex hormones, but that comes back up in a couple of days, 4 days, and starts suppressing these. So you get an initial surge and then a suppression of the sex hormones. And it's very effective. We see that in the males and the females both, it can be very effective at suppressing the hormones. I put on here every 2 weeks for 3 times. It depends, very much is case dependent. Some females just need 1 injection. Sometimes they need several injections. The males, usually we have to do several injections with them in order to completely suppress their hormones. And it lasts for variable lengths of time. So in some females, if you can give them 1 injection or a series of injections, that'll last them till next year, next breeding season or whatever. For a cockatiel that's really intent on laying eggs, it may only last a month or something like that. So that's when these other things, modifying the environment, the diet, the behaviors, all that, those become really important because the hormones just don't work as well in some of these birds. Another thing that works at the same level as the Lupron is the deslorelin implant. So it's a little implant, looks like a grain of rice that we put generally underneath the skin on their backs. And that also causes initial surge in the hormones from the brain, leading to an increase in sex hormones and then the negative feedback like we talked about earlier. I put on here, it's approved in ferrets only because legally I have to say that the implants are not labeled or licensed for use in birds in the United States. For those of you that are in other countries, that may be a different story, but in the United States, they're only licensed for use in ferrets. Just putting that out there. I'm not saying that some birds don't have deslorelin implants. I'm not saying some vets don't put them in. I'm just saying that's legally what's going on in the States. Hopefully that'll change in the future, but for right now, when you get the package, it says only licensed for use in ferrets. So why don't we just spay and neuter birds? Well, in dogs and cats, it's kind of a routine thing. It's a very simple surgery, very quick recovery, minimal risks. In birds, anytime we put them under anesthesia, there's more of a risk than there are in dogs and cats. The bird's body size is smaller than typically a dog and cat. They lose body heat very quickly when they're under anesthesia. The metabolism is very high. And so it just makes them a bigger anesthetic risk in general. But specifically for a spay and neuter, the sex organs lie very close to very large blood vessels and close to the body wall in the birds. And to get to the ovary or the testicles can be very difficult. And to remove them can be very dangerous without damaging these vessels and leading to fatal hemorrhages or something. So it's not something that we do approach lightly. There are some situations where everything else that we've tried doesn't work, and the female keeps getting egg bound and whatnot, and the owners are aware of the risks and go ahead and proceed with the surgery. But it's not something that we do routinely or want to do routinely. So again, using the other tools in our toolbox hopefully will avoid the need for this. So in summary, we know that the hormonal behavior in these birds can affect them physically, but it also mentally and emotionally can affect them. And so in a bird that's not going to um, raise birds in our homes, um, we we want to try to suppress these behaviors so that we can avoid these mental and physical effects on them. And then we do that by modifying their diet, modifying their environment, how we interact with them. And if we need to, we can intervene medically as well. But again, the diet, environment, and providing alternate behaviors, that kind of thing, are much more important than the medical intervention. Without, like, we could just do medical intervention alone, and it would not be successful without doing these other things. All right, so that's all I have. So what do we have in the way of questions?
Thank you that you made a complicated topic very manageable. That was so well done. Thank you so much. I have some bad news for you, though. Rosemary Lowe's Understanding Behavior Cues from Nature is out of print.
Oh, no.
So, yeah, it's tragic because it's one of her better ones.
Yeah.
So hopefully she'll get it out again because we like it too. I agree. It's a great book. You do have some questions, and I bet there'll be more coming. You want me to digest them for you? So if let me see if try to find. Well, first of all, here's one near and dear to me. Somebody wants to know, their two male birds are always masturbating on each other during the season. Should they separate them, or will that cause stress, or just let nature take its course?
That's a tough one to answer with a simple answer. It kind of depends on whether there are other hormonal behaviors, whether we're seeing things like increased aggression towards the owners, feather destructive behavior, increased aggression towards each other. In those situations, then you may want to modify it, maybe separate them temporarily. It also depends a little bit on the birds, because if the birds have a really long breeding season, then it may not be fair to them to separate them for a long period of time. But if it's a shorter season, then it might be more feasible to do that. If that's the only thing that you're seeing as a sign of hormonal behavior, then it might be okay to just let them be.
I agree. She says you can't touch them during this time, but I'm amazed she can touch them at all. I mean, my experience with bonded pairs is don't try to get in between that. So
yeah.
Does discouraging and interrupting masturbation cause some frustration? And if so, how to deal with that?
I think if you use redirection in conjunction with the discouraging, I think that will kind of help ease that frustration, giving them something else that would be a pleasurable thing for them to do and to distract them from the masturbation. So I think you can avoid the frustration by just encouraging other behaviors.
How do you feel about them just getting some of that out of their system, since nature kind of calls anyway, and it's not something we can usually totally suppress? I guess the question is, when does it become dysfunctional versus when is it actually helpful to just let them express some of that?
Yeah. So if in this topic, there's not any easy answers, right? So it all depends on the big picture. So again, if you're seeing a lot of hormonal signs, you're seeing behaviors in the birds, like you're not able to handle the bird during this period of time or something like that, and that makes them less, what's the word I want to use? They don't fit in the household as well. And in my mind, and probably in Anne's mind too, that means rehome, that leads to rehoming down the road.
Hard rehoming. Yeah.
And so that's another thing that we're trying to avoid. And you have this bird in your home, you want to interact with it, you want to have a good relationship with it. And so if allowing the masturbation leads to other things like aggression where you can't handle it, or um, feather destructive behavior or something like that, then no, I don't think it's good to encourage it. But if it's just kind of an innocent thing from time to time and you don't see any other behaviors associated with it, then it may not be a bad thing.
Gotcha. So I should tell Phoenix that the other green wing he adopted gotta go. Gotta go. No. So there was a question about age and when they start to show hormonal behavior. And that's a great question because I don't think we have totally reliable information about when puberty and sexual maturity hit in each species. I know Liz Wilson kind of gave us a framework about 20 years ago, but I'm not sure anything's been updated since.
Yeah, so in the little birds, they can start to be sexual, but by that I mean like cockatiels, lovebirds, parakeets. They could be sexually active or sort of hormone circulating even as young as like 6 months of age. And the larger the bird, the longer it is to puberty. So let me see. So this is a African gray. I think 1 year old would probably be a little young. Having said that, we always say in dogs and cats that 6 months of age is when they start their hormones start circulating. But in recent years, we've seen a huge number of younger animals, like cats often coming into heat at 3 months of age, 4 months of age.
Wow.
We know in humans that kids are maturing, entering puberty at younger and younger ages. And whether it's due to the environment, whether it's due to the diet,
Hormones in the food. Yeah.
right? I don't know. So what we knew, like you were saying, what Liz Wilson knew 20 years ago, 30 years ago, may be very different from what's happening now. So, I would just say, based on the level of the rate of maturity in the African gray, that 1 year would be too young for it to start showing hormonal behavior. But again, things are changing. And so it may be that these birds are maturing younger than what we have known.
Right. She talks about that drooping the wing and chittering, she calls it. And that's probably kind of a begging thing. It could be begging for many reasons, not necessarily reproductive reasons, right?
Behavioral, it could be illness. Yeah. So it's certainly something that would be worthwhile checking out with your vet, just to
that kind of begging behavior could also be just like, I really like you and
right.
Come get me, be my transportation system so I can go somewhere.
We see that with grays, and we see that with Quakers a lot too, and not related to hormones.
Right. Agreed. Several questions about UV lighting and how much and does it cause damage and vendors.
Yeah, so certainly UV light in excess can cause damage. So you want to, and there's been reports from AV, different brands of lighting were put out more UV and potentially were more dangerous than others. Usually if you're using a UV bulb, I don't recommend using it for more than, say, 30 minutes a day, something like that, and keeping it, depending on the brand, usually about 2 feet above the bird. Outdoors, if they have some kind of shelter, I think they're good. If you have a feather picking bird or a bird that has a lot of naturally bare areas, like some of the macaws, for example, you want to be careful with those bare areas and the UV exposure. But I think if they have a place where they could get out of the direct sun, then the UV outside is fine for them.
I recently discovered a new brand that I like, Arcadia, I think it is. Have you heard of it? There was one Zoomed. Isn't that the one that initially had some concerns for the retina, but maybe that's been rectified? I'm not sure. Do you know?
Anything that puts out UV can be damaging to the eyes.
UVA and UVB, both UVs. could be damaging, you think?
I'm not sure which specific one it is and that affects the eyes.
Mhm.
But we've seen cataracts in association with UV lights.
Wow.
So you do have to be careful with them. And that's why I don't recommend with the bulbs to use them. And some people want to keep them on for hours of the day, and that's certainly is excessive. But they also have it 5 feet above the cage, which isn't going to harm them. It's not going to provide any benefit either.
Probably, exactly. Like 18 inches or something, I think is supposed to be
Yeah,
optimal.
yeah. So you definitely want to be conservative with it.
Yeah. Yeah. And it took me a long time to understand that UVA and UVB were distinctly different. And I think it's the UVB that helps with the calcium absorption, the D3. Which is harder to come by in terms of most of the ultraviolet lights. It's more unique.
Yeah, so a lot of people will use the reptile bulbs, the full spectrum reptile bulbs, but even within those, there are different wavelengths. So you have to really look at the packaging closely, make sure it is full spectrum with the UVA and UVB.
Right. One of our adopters says, for a 20-ish old Moluccan, how many eggs in what time frame constitutes chronic egg laying?
How many eggs and over what time frame? So cockatoos typically in a clutch will lay 2-3 eggs. And well, that's actually one thing that we didn't talk about, that so if a bird does start laying eggs, you're not able to suppress the hormones. You may want to leave those eggs in there to let them lay their clutch and then kind of go through the incubation period, and that will work through and they'll suppress the hormones for the future. With a lot of species, if you take away the eggs, they'll keep trying to replace them, and so you'll get into chronic egg laying. But in answer to the question, yeah, I think one is too many.
Do you really?
But
Across a lifetime, you think they should not lay the egg?
lifetime. I thought you meant within like a couple of months or something like
Oh,
that.
well, I figure if they're going to lay eggs at some point, so her question is how many is too many across a span, but I figure at some point they're going to lay eggs in their life, right? I mean, nature just.
We do see in the cockatoos, for some reason, a lot of them will wait until they're in their 20s before they start laying eggs. But those I would have checked out because a lot of those will end up with cysts on their ovaries.
Wow.
And so that becomes a medical problem that's affecting this. And so it's not just a natural behavior for them. There's actually a physical problem there. So if that's the case, if the bird's never laid eggs for a long time, and then like in their 20s or something starts laying eggs, then I would have a medical workup done on that bird. If it started when it was young and it lays eggs, like we have some clients whose birds lay eggs, a couple eggs every spring or something like that.
Right.
I mean, I think that's an acceptable amount, but if we can get it down to none, like if we see the hormones ramping up and can discourage that so that they're not laying the eggs, because every egg that they produce is a potential, there's not going to be any benefit, there's not going to be any chick that comes out of it, but there's a potential problem that comes with every egg that forms. And so we want to try to not have them lay eggs if we can avoid it.
If you know that a bird, like say a macaw traditionally lays like 3 eggs, if a bird is going to lay a set number or just wants to lay eggs, what do you think about those artificial eggs? And will that extend that hormonal desire, or will that curtail it? Or is that a individual subject?
We've had some clients that have tried to use the eggs to fool the birds into thinking that they have laid a full clutch or that they don't need to lay eggs. And I would say it works with variable success,
Mhm.
because remember, it takes, depending on the species, but usually around 48 hours from ovulation until the egg is laid. And so if the bird lays an egg and then you put two more in there to try to discourage it, well, the second egg is already
Mhm.
on its way down.
Mhm.
And so it may not have any effect on that at all.
Mhm. Um, a few food related questions. Can you recommend a pellet that has a lower protein or fat content? If you're trying to reduce both, is there a optimal choice?
I know that Rowdy Bush used to have a low fat pellet. I don't know that they still do.
Either.
Um,
Most pellets in general are pretty high protein,
right,
right? I mean,
right. Harrison's is generally higher in fat than something like Rowdy Bush. And it's particularly the high potency.
mhm.
So, you definitely want to switch them off the high potency if they're on that, maybe even from Harrison's to Rowdy Bush or something, or to Lefebvre pellets, which I believe are lower in fat as well,
Mhm. I think so too.
at least temporarily.
I love the new Lefebvre tropical pellets. I think they've been well received by a lot of species. So even the little birds, which I don't usually feed a lot of pellets to, seem to like them.
Great.
So you recommended certain foods during that hormonal surge. Does that apply to both males and females?
I recommended, you mean the food I recommend?
Yeah, the ones you recommended avoiding. Sorry. Mhm.
Yeah, so it will suppress hormones in both the males and the females, because when we give the Lupron, that's not a testosterone, that's not a male hormone, that's actually a female hormone, but it does cause suppression of the male hormones. So the same thing with the phytoestrogens. So if you limit those in the males, it will suppress the testosterone as well.
Are hemp seeds considered high protein, high fat, high phytoestrogen for?
You have phytoestrogen, they are high in phytoestrogens.
They are, yeah.
So that's on the list.
So they have that great omega, and then
Yeah.
so
That's
when
like
you
I said,
say
I
fat, do
don't
you?
recommend not feeding them, because a lot of those
Yeah,
foods
yeah.
are really good foods. But when you have a hormonal bird, it might be best to limit those
Uh-huh.
temporarily.
And when you say fat, are you talking about whole fats like omega-3s and 6s, or saturated?
Yeah.
The omega-3s that we so often recommend, do they fall into that fat category?
Yeah. And again, it's not a permanent thing. It's just a temporary
Uh-huh.
change in the diet.
Spring is here. Let's make babies.
Right.
Yeah, yeah. The Annette, who was asking about the Moluccan with eggs, she says there were 8 in 3 months. They were all individual eggs, not clutches. That does seem a little
That's
excessive.
excessive. Yeah.
I wonder if there's some stimulation going on that
And
they might not even realize they're giving. That's
the 20-year-old.
Mhm.
That's never laid eggs before.
I don't know about that.
Yeah. If it's never laid eggs before, then I definitely would have a workup done on it, because that's a lot of eggs out of the blue.
Yeah, it does seem. Someone's asking about tops pellets and that question about protein and fat. I don't really know. I know tops definitely is more nutritious if your bird will like them. That's always the question. I don't know about it.
I don't know about the fat content in the tops pellets. Sorry about that.
Is it okay to use a full spectrum light for longer periods of time? M&M Cage Company full spectrum light. Not exactly sure what that means.
I wouldn't use it more than 30 minutes a day, because that's all they really need to absorb the vitamin D3 and the calcium. So, anything more than that, you're going to risk skin damage, you're going to risk eye damage, things like that. So
yeah.
it's not worth it.
Have you ever found the hormone shots like Lupron to only delay a spike in hormones and then they go through the hormone cycle after the effects of the shot wear off, which extends the hormone cycle? Meaning they have to constantly get the shot?
So that's what I was talking about with the cockatiels, because cockatiels, you know, we've done a great job with our birds. We provide them this great environment. We've optimized their diet. Like their diets that we have for them now are light years ahead of the diets that they had 30, 40 years ago. And so, we've really done great things for our birds. But the downside of that is now the birds are in a great place happy place to want to reproduce. And so, we want to try to cut back on some of that good stuff that we've given them. The cockatiels have gone from being kind of seasonal breeders to year-round breeders in our house because they have, pretty much standard lighting all year long. They have this good food all year long, and they want to reproduce. And so the hormones in those particular species can be kind of a temporary thing. That's why the environmental manipulation is so important in those guys. Because it will, once the shot wears off, if those stimuli are still there, then the bird will start cycling again. Other birds like Amazons, for example, if you can get them through that 1 month, 2 month period of where they normally would breed, like in April, May, June, then they're good till the next year. So it really depends on the species.
So April, May, June, because that coincides with spring in terms of weather. Is that why you say that?
I guess, I'm saying it, so I guess I should clarify because I'm forgetting that we're international now. So like in the United States, in most of the states in the United States, that's the time of year where the Amazons will breed because it most naturally stimulates the breeding season for them. Time of year light wise.
Yeah, it's so hard to know sometimes what their bodies are calibrated to South America or the Southern Hemisphere, and yet we're in the house and we turn on the heat. I find a lot of birds start thinking it's springy when we turn on the heat, and they think it's warmer. I think we're kind of dysfunctional sometimes in terms of what they don't know what to interpret.
And we do see that a lot too, not only with the hormones, but also like in things like molts. Where you can tell the birds' bodies are just so confused because they'll go through a partial molt and then nothing. And then 6 weeks later, they'll go through another partial molt. And, it's just, I think it's really confusing to their bodies to be in a controlled environment like that. And especially if it's not uniformly controlled, like you were saying, where it gets warm and then it gets cold, or we put the heat on, or whatever. It can be really confusing to them.
Yeah, that's what I find too. Someone with a female Moluccan is talking about cardboard boxes and everything, which we do a lot of here. I must say the cockatoos all have their boxes. That keeps them very balanced, I think, in a lot of ways. But anyway, their male Moluccan wants to snuggle. Wait a minute. Gets near her boyfriend, Bevy, our male Moluccan. She starts vibrating and snuggling under him. He wants no part of it, uses his beak to push her away, and then either runs or flies away himself. Well, clearly he doesn't feel the same way. That's all I would say, Alexander. I mean, is that so bad that happens? I mean, maybe it's exacerbating her feelings of hormone behavior. She's the egg layer.
Yeah. So it will, just the behavior alone, even if he's not reciprocating, can cause her hormones to ramp up. But his kind of rejection can also lead to frustration on her part. And then that can lead to things like feather destructive behavior or other things that may not be desirable. So yeah, I would probably not encourage that either.
You talked about not providing food all day during the breeding season. What does that mean? Like twice a day? Or I remember way back when there was a Feeding Feathers Yahoo group, when we all did Yahoo groups. I got so much great information out of that. And Shauna Roberts said, don't feed them in the afternoon. Their crop needs to get a little reduced anyway. And so I've always kind of practiced that for the last 20 years. But I guess the question is, do you mean like feed small little meals or twice a day, or
Yeah, I would do like twice a day feedings. And
give a break?
yeah, and I do that for my birds. Like I truly believe, not only for hormonal reasons, but I think that we still don't know all we need to know about bird nutrition. And I still wonder about the protein content in a lot of the foods that we're feeding them. And I think if we constantly bombard them with high levels of protein, that's not going to be good for the kidneys in the long run.
Mhm.
So I think if we feed them a meal in the morning, give their body a chance to kind of metabolize and deal with all that protein and the nutrients and get rid of the wastes, and then before their next meal, I think overall that will lead to a healthier life for them. But in regard to the breeding, if they don't have access to food all the time, then they're going to be less inclined to want to raise babies.
Mhm. I Somebody wanted to know if there was a list of foods with fat and protein content, which is higher and lower. I don't know. Dr. Google is probably the best place for that, huh?
Yeah, and it's difficult to determine because a lot of the packaging doesn't go into a lot of detail as far as that goes, and some of it depends on how much moisture is in it. It definitely depends on how much moisture is in it, and so you can't just compare label to label. But I'm not aware of a resource that's actually put everything together in one table. That would be great.
Yeah,
And
a reputable source. When a bird first comes into our system, we do a full workup, as you know, with labs and all kinds of details, bile acids for the liver, et cetera. But we usually do cholesterol too. But unless we know total cholesterol, we're not really getting a good reading in terms of like for heart disease, right? This is kind of a little off topic, but is it worth like testing for triglycerides? Should that be a more common thing we look for? Because we're just seeing so many birds right now with heart disease.
right.
With we have one vet who does that regularly, and I thought, well, maybe that's kind of helpful information, actually.
Yeah, I think most of the panels, the routine panels, have just cholesterol on the panel.
You
Some
have
of
to ask for triglycerides. Yeah.
some of them, right? You have to ask for specifically for triglycerides, but if you have a cholesterol that's greater than 1,000, then there's something that's triglycerides are going to be elevated, and so you can use that cholesterol reading to interpret that somewhat, but it's in the kind of in between areas where maybe it's slightly elevated or something like that. You may not know whether that's harmful or not.
Well, I always have this running question about eggs because Dr. Orris is a pro egg and Dr. Eccles is an anti-egg. And I remember in our Zoom retreat when we had the COVID and we had to go the whole 2 weekends, all Zoom, Dr. Eccles said, it's the total cholesterol that you look at, not just the cholesterol, to know if there's really a cholesterol problem. So I thought, well, maybe we need more information somehow. And if that, because you were talking about cholesterol in females when they're in the hormonal mode too.
Right.
So I didn't know if any of that all tied together, triglycerides. Geeky lab person that I am that tries to always understand these complicated issues.
Yeah, I think that's another area that a lot of research still needs to be done in, because 10 years ago, we weren't even really even talking about heart disease or
Right.
atherosclerosis in birds. So I think that's a good area for research. And I think as the research is done and more information is learned, then the routine testing standards will change and things may be incorporated that aren't on the routine testing now.
Yeah. Is there anything you see coming up through the veterinary research world that gives you hope for dealing with these hormonal issues better? I remember Scott Stahl used to always say, he really wanted to have a spay and neuter. I mean, that was his mission like 20 years ago, but I think that's kind of gone by the wayside as surgery's gotten complicated in that area, right?
And there's been all kinds of attempts like trying to reduce the surgical time using endoscopy rather than opening them up. And it's just there's so much risk associated with it that unless it's kind of what we call a salvage procedure where everything else has been exhausted and
Mhm.
you try to help, but you realize that they may not survive kind of thing. So yeah, but I mean, that's not going to change because the bird's anatomy is not going to change.
Right.
So it's just, we have to pharmaceutically, I don't know of anything else that is coming along that we can use.
Mm.
The Deslorelin works pretty well for longer term. The Lupron works pretty well for short term. So I think with those two, we have good control.
We still get surprisingly relinquishing forms from people who say their veterinarian told them to get their bird a mate. So they're either wanting to adopt a mate or relinquish one. And so some of those veterinarians that don't practice as thoroughly with birds as say you and your colleagues do are still like, just go get the bird a mate, and that's kind of discouraging because
Well,
not the fix.
Yeah, I mean, this opens up a whole can of worms, and I think I saw maybe we had someone from the Netherlands on the chat.
Probably, and definitely have some Europeans.
So, things there are very different from what they are here, and they actually, by law, have to have two
more
birds
birds in a household.
in the if you have one bird, you have to have two. It has to have a companion. And I think they also have different views on the breeding and the mating of birds. Like, I mean, I may be wrong, but I think that there is more of a thought that this is a natural behavior for them, and then we should allow them to do this. And truly, like if we were in the non-selfish zone and what's truly best for the bird, then that might be what's truly best because that's the most natural for them to be. But it always goes back to they're in our homes. We have to live with them. We have to make their lives and our lives the best that we can to cohabitate together. And so it's a big ethical dilemma. Which side do we fall on?
Right. Because they're going to grow up and
Right.
they're going to have a desire to mate again.
Right.
And then somebody's got to give them a home.
Right. Because if you think about humans and asking humans to be celibate for their whole lives, like how well that would go over. So, I mean, we do it for the dogs and cats. We take away their hormones. But it's a whole, like I said, it opens up a whole can of worms, like what's ethically correct and what's not.
Right. And there seems to be a subject of one. I mean, for some, leaving the eggs works for them, or giving them a box works for them. And I don't know, I always try to find that balance between letting them exhibit that natural behavior and it not becoming dysfunctional,
right.
Over too many egg layings or prolapsing
And I think that's I guess that's the best word that I haven't used. Dysfunctional, like trying to let them be birds but not have the behavior become dysfunctional and lead to problems. So
we talked a little bit about happy huts, and I just want anyone here today who's not signed up for the retreat to know that one of the things we're going to show, one of the veterinarians who's speaking, and we saw this at the exotic conference a couple of years ago, is going to show a video of a conure who had a great time ingesting the happy hut, which happens a lot, and the surgery that followed was quite I'm not a veterinarian, but even the veterinarians in the room gasped, I think, when we watched that video, right?
Mhm.
It was pretty remarkable. It was enough for me to go take all the fabric out of any cage that I saw anywhere. Yeah. So come join us on October 2nd, if that sounds like something important for you to know. Oh yes, Laura has a good question. Talk about when they do lay eggs, there are ways to make those not fertile if it's a pair, a bonded pair, so they don't have to actually have a chick. You want to talk about ways that can.
So you talked about the artificial eggs before, so you can swap
No,
out.
an actual egg, like a male and female actually have eggs, but
Right.
you don't want chicks.
Right.
But you can do things to that egg and put
Right.
it back in the nest.
So you can shake the egg and break up the yolk, and that will
Render it infertile.
right. Or you can replace the eggs with artificial eggs. In either one of those things.
I've often recommended putting it in the freezer, especially if they lay several eggs, and then taking it back out in 24 hours. Is that a legitimate recommendation?
Yeah, I mean, I'm sure it would kill the embryo if you did that, but
just seemed a little
shaking
less
just
invasive. Yeah.
shaking just takes a few seconds, and then you can put the egg back, whereas in the freezer it'd have to be gone for. So you'd either have to replace it with an artificial egg temporarily or something else.
Right. Some people have it's ethically harder to shake. Yeah.
Yeah.
It's a hard question. Somebody wanted to know, when the bird is spayed, is it the complete taking out all the sex organs or just the ovaries? Do you know?
So good question. So that's another reason why we don't routinely, and I think this is probably why Scott doesn't routinely recommend it anymore, is because we remove the oviduct, because the ovary is too adhered to everything around it to remove it. So we actually remove the oviduct and leave the ovary. So in some of these, and it was thought that without the oviduct and the uterus there, that there would be a negative feedback, and that the ovary would become inactive and they wouldn't ovulate anymore. Well, that's been shown not to be the case. And so the females that have been quote unquote spayed still can ovulate eggs, and that there's nothing there to receive the follicle once it ovulates. And so it ends up loose in the coelom, and then can cause inflammation, coelomitis in the cavity of the bird. So it definitely is not a cure-all for sure.
It does sound complicated. Oh my goodness. I think we've tackled most of the questions. Do you have anything else you want to just make sure people take away? Don't be sexy with your parrot.
Yeah, I mean, I want people to have as good a relationship as they can with their birds, and I find that a lot of times hormones get in the way. And I mean, I think what we talked about as far as modifying the environment and modifying our birds' behavior and our behavior, I think is so important to give them a happier life and try to avoid situations where, like you said, the hormones become dysfunctional. But not only that, doing those things also will just generally improve our relationship with the bird and make the bird mentally happier. So I think it's a win-win situation.
Agreed. There are so many ways to have a positive relationship. And we always encourage people to not expect to touch a bird anyway. I mean, that's kind of antithetical to their nature. So why should we expect them to act like mammals?
Right. Yeah, actually, yeah, most of our parrot species in the wild never touch each other. And even bonded mates, they may sit next to each other, but they very rarely will actually touch each other, except when they're preening each other, whatnot. But touching each other, they usually will not do that. So it is a very unnatural thing.
Of course, we don't know what's in their head, but my theory on that was always that as prey animals, they needed to be able to fly away really fast if something was coming to get them. And if you're right up against your mate, it's kind of hard to spread those wings. So
That's true.
they like to have that option to get away from us too. So that personal space, something I don't think most people go into having a bird appreciate enough. So it's one of those concepts we try to bring home a lot. Just enjoy the magic. Anything else is extra. So
Right. Great.
well, you have made this topic so manageable and so easy to understand. It's just a great baseline for such an important aspect of our birds' nature that I just can't thank you enough. It's been terrific.
Well, thanks for having me.
Yeah, well, create another class and come back next year. No, thanks a lot, everyone, for being here. I hope you took some new ideas home to put to use, as always, the goal of our talks and events. So appreciate you being learners and trying to do better by your bird in captivity. That's all we can all aspire to, right? So thank you, Frank.
All right,
Thanks,
you.
everyone. Have a great weekend, and we
glad.
hope to see you on October 2nd and our other events thereafter. So thanks again.
Bye.
Bye.